my beautiful people, you're welcome to another episode of Nursing with Abby. My face just lights up anytime I want to create a video about nursing, nurses, and everything in between. So today we are going to be talking about Wetin Midwives Dey do sef. You know, I've always been seeing some of the placards that people place on their cars. They said, Wetin lawyers they do sef. So I just decided, okay, let's think about it. Wetin midwives they do sef. What extraordinary thing do they do that makes them all the way and they are so proud of themselves? Because sincerely, I am proud to be a nurse and I'm proud to be a midwife. But before we go into the topic for the day, I would like to thank all of my subscribers. I want to thank all of you for your love and support. Sincerely, I do not take it for granted. Thank you so much for acknowledging consistency and hard work and for supporting me thus far on this channel. I really appreciate doing more and more videos with you. Now, if you're watching me for the first time, you're welcome to Nursing with Abby. My name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. I talk about nursing, lifestyle, and everything in between on this channel. And I love for you to always support me also by liking, by sharing, by subscribing, and making sure that you share this video with your friends and comment in the comment section. I'd love to hear from you. So today we are going to be talking about Wetin Midwives Dey do sef. Now remember that the last episode I talked about we eulogized or we celebrated a beautiful and awesome midwife as she was able to take delivery in a public transport and making sure that the mother and baby are alive and safe. Now a lot of people wonder, is it so easy to be a midwife? Is it so easy that anybody can just say, I'm a nurse, I'm a midwife, and then take delivery in the vehicle and, receive a medal of honor? Of course not. It requires a long period of training also, apart from nursing training, I mean. Now, in Nigeria, before you can become a midwife, a registered midwife, you probably would have completed your nursing program, and then you go for midwifery, which is a year or a year and a half. That's 18 months. We have some people who delve directly to registered midwifery certification first, but those ones will spend 3 years. But for me, I went to register I was a registered nurse first, and then I went to School of Midwifery for my registered midwifery certificate for 18 months. 18 long months, but they were productive months, I must say, because we learned a lot from our highly esteemed lecturers, from our highly esteemed clinical instructors, and they were able to put us through the ropes of the profession every step of the way. I really appreciate you. I doff my hat for all the people, all the teachers that made me who I am as a wonderful midwife today. Now, I just want to give you a definition of midwifery or midwives, and sincerely I wrote a script, but I know I'm not going to follow the script because it's just inborn, it flows. So a midwife is a person who cares for women and babies during the antenatal, intranatal, and postnatal period from time to time. Now they provide high quality, cultural sensitive care during labor and conduct a safe and clean delivery, and also give care to the newborn, refer any emergencies, or manage whichever ones she can manage within the scope of her practice, and all these done to ensure that there is drastic reduction in maternal mortality and morbidity. So there is a lot of tension or work a midwife would do to reduce maternal mortality and morbidity. So you might ask me, what exactly is this care all about? Now, in midwifery school, we are taught about being entrusted lives to us. Now, we have like a woman is just one entity and she's pregnant, that's another entity, or she could be pregnant with twins, which is the third entity, or even triplets, which is fourth entity, and so on. So we are dealing with one or more lives. Now, for a woman to have gone through the rigors or training of being a midwife, now it's always registered in our brain that we cannot afford to be careless. We cannot afford to be how do I put it now? There's a word I'm actually looking for, but we cannot afford to be careless because we have lives entrusted to us. Now, right from the time of conception, you find a midwife who will give you advice as to what to do. Up to the time of pregnancy, which is 9 long months on the average, you keep coming to the clinic and you keep having encounters with midwives. They'll take care of you and ask you questions that would help them to give you the high quality care possible. And whatever questions you have, you can always ask a midwife. She's always ready to answer you. Midwives are wonderful and great people. Now we get to the point of labor and delivery, and that is the point that even the most noblest of women lose it because of the pain of labor. Now a midwife is always there to hold your hand. A midwife is always there to soothe your pain. A midwife is always there to encourage you. A midwife is always there to support you. A midwife is always there to comfort you. Now, at the period of birth, which is that climax, a lot of women do not even know what they are doing at that time. But a midwife has to be sane enough to realize that this project must come to fulfillment. This baby must be born. She is able to monitor the progress of your labor, and she's able to detect any abnormality early enough and ensure that it does not become a complication later. She is able to decipher from a wealth of experience that maybe the baby is likely too big and this labor will likely be prolonged. She would communicate with your healthcare provider to seek of better ways to be able to manage and take care of you so that we can have a healthy mother and healthy baby or babies. So you can see the immense benefits that midwives they have. Now we are now getting into the time the baby comes out. Now the first person that picks up your baby definitely is the midwife. She ensures that your baby breathes well, your baby cries well, your baby moves well, your baby is able to function effectively as a unit outside of your body. And then she bonds you to your baby by encouraging you to breastfeed. Now, she's not done with the work of the mother yet, because she still has to ensure that the placenta is removed. She has to ensure that you don't bleed. She has to ensure that all the physical features of the woman is still complete and she's okay. And then they move her to the mother is moved to the ward where she recovers. The job of the midwife is still not ended there, because if any baby needs resuscitation, the midwife is the first person before all other members of the health team comes into play. Now, we go into the postpartum period, which is after delivery, where we bond the mother to the baby, where we encourage breastfeeding, we encourage bonding in, we encourage the mother to, exercise her complaints, whatever that she's going through. We help her to cope through the pains of labor, and we assist her to ensure that the postnatal period is seamless. Okay, so there's the immense benefits of midwives is so much. She also gives immunization to the mother, to the baby, after delivery, sometimes even at the infant welfare clinics. Midwives can function effectively in so many areas without a hitch. And that is the immense function. Those are the immense functions of midwives. So, do you have any midwife around you? Or can you even remember the midwife that helped you with the birth of your baby? Why don't you just say a word of prayer to her right now, to thank her, to bless her, and to encourage her to do more? Because indeed, midwives are angels on earth. And I am proud to be a midwife. So all midwives out there, I doff my hat for you. I thank you so much for your immense, selfless service to ensuring that maternal mortality and morbidity is reduced to the barest minimum. We know we'll still keep on pushing through the sleepless nights, through the crazy night duties, through the numerous deliveries, through the crazy neonatal resuscitations to ensure that a pregnant woman comes into your life and walks out with her baby hale and healthy and alive. So thank you so much for another episode of Nursing with Abby. I really am so ecstatic having to share this with you, because I became a midwife by the reason of a motivation from a beautiful nurse named Nurse Oyedele, and I wish she listens to this, because our motivation and inspiration and encouragement has groomed me to be the wonderful midwife that I am right now. Thank you so much, Nurse Oyedele, and God bless you. All right, till I see you in my next episode of Nursing with Abby. Thank you so much. We'll see you again on the next episode. From me here, it's bye for now. Make sure you like, share, and subscribe.